3. Hi, my name is Dr. James Robles. I am the owner and director of Elite Medical Fitness. I'm an integrative clinic here in Weslaco, Texas. I'm a former anesthesiologist. I'm board certified in pain management and anesthesiology. However, in the last, I'd say 10, 25 years, my side interest, and now my primary interest, is musculoskeletal medicine alternative approaches. I call myself a prolotherapist for the last 25 years. That's the most basic form of regenerative interventions. The way I treat the body, I treat it through a whole body approach, meaning that I examine the entire patient and I appreciate the connectedness of ligaments, tendons, and muscles, because in a way, this is not the way the body looks like. The body looks as a combination and a molding of all of these tissues together. I examine the body and I basically treat what those areas of weaknesses are with a medicine, a solution that creates healing responses. I also use diagnostic ultrasound. Diagnostic ultrasound, as you see, is a very valuable thing in terms of, again, my holistic approach is I also look at circulation. I look at circulation, I do functional exams, which we'll talk a bit about later, to determine if there's significant arterial dysfunction, oxidative stress. All this keys into prognosis of the patient in terms of their ability to repair, because if their circulation is bad, their pain is not going to get any better. We use diagnostic ultrasound. This is a particular patient where I measure what are called the thickness of the plaque. And you can see from the thickness of the plaque, the average is between 1 and 1.3. Anything over 0.6 is an increased risk for cardiovascular events. So we use diagnostic ultrasound, vascular ultrasound, and we use musculoskeletal ultrasound to basically treat these patients in a way in such we get them in better shape. These are ligaments. These are what are between bones, and these are the targets. All these things are key ligamentous areas, and I see in examining patients, these areas always demonstrate a pattern of pain. These are the usual areas of pain here, but again, I emphasize this is all one big connective tissue sheet, and in essence, this is not exactly the way the body is. Why don't you come with me here? We're going to go into another area of the clinic. Okay. All right. The other area is called hormone optimization. I consider myself an expert in hormones and basically optimizing hormones to optimize the patient's ability to reduce basically harm to their bones, harm to their arteries, harm to their brain. And all that translates into basically a decrease in osteoporosis progression, a decrease and actually a reversal of circulation and atherosclerosis. You can see here, this is a picture of the artery, okay? And you can see the picture of the artery is basically when your artery is 17, when you're young, arteries when you're 25, there's your artery when you're middle-aged to older, 65, and this is pretty much when you're dead. That plaque ruptures and it creates an event, that event being a stroke or a heart attack. What we do here is we use intravenous solutions to prevent this from progressing and also reverse stroke. You never get a heart attack. I have some shocking things to tell you. The main use of cardiologists in our conventional medical approach is statins. Statins, I repeat, they use statins. This is what they have. This is from the clinical reviews of clinical pharmacology. This is what statins do. They're given out to every woman to lower their cholesterol. A 2015 review of clinical pharma showed that statins, while effective in lowering cholesterol, deplete nutrients because coenzyme Q, vitamin K, selenium. So basically, what we're seeing here is that when you take a statin, you take all these important things from you. You take your vitamin K, you take your vitamin D, you take your coenzyme Q, you take everything and you just remove them. Now, unless you're replacing all of this, then basically you've equalized the harmful effect of a statin. The other thing that I have some bad news is statins. There are studies that show statins cause increased risk of breast cancer. Here we have it here. The risk of breast cancer was increased 65% in women randomized to pravastatin. This pravastatin associated breast cancer risk. Not good. Okay? Not good at all. And then we have, again, the elevated risk of breast cancer associated with use of Prevacin. So here we have it here. Now, the other thing that we use here is called autonomic nervous system testing. Okay? Autonomic nervous system testing is a 15-minute exam in which I can actually look at your arteries. And here I'm going to do it here. And you can see here, autonomic nervous system, we get functional markers. We can tell what your fibrinogen, heart artery blood flow, insulin resistance, and all of these things. So basically, it's a key into how your body is doing. And we do this by these methods here, okay? So this is a 15-minute exam. Everyone gets it. And this 15-minute exam, we're able to tell inflammation, heart artery blood flow, insulin resistance, and this is years before they know they have a neuropathy where they don't feel their feet, they step on a nail, they get gangrene, and next thing you know, they're having to have their toes cut off. So the marker of insulin resistance is very important in detecting early progression of all of these things that can cause heart attacks, strokes, and worsening, increasing risk of cancer. So here we have all these tools. Why don't you keep following me here? On the way, following me, we have what's called shockwave therapy. This is a non-invasive way in which we treat ligaments, tendons, and bones, not with the needle, by high frequency sound wave to promote healing. So these is a magnet, and these are two forms of shockwave. This works just like a regenerative injection, except in the form of a intense sound wave. Come follow me here. And this is my love and my joy, the ultrasound machine. I'm certified in diagnostic ultrasound. I was one of the first doctors to become certified in diagnostic ultrasound. So within about, let's say, 5 minutes, I can diagnose the condition of your knee, meniscus tears, rotator cuff tears, spurs, fluid effusions. This particular person has a significant rotator cuff tear. You can see this area here. You can see the osteophytes and disruption in the bone itself, avulsions. This patient actually was treated last week with bone marrow aspirate. I isolated the stem cells relatively from his bone marrow, and I injected these areas with bone marrow aspirate. And hopefully he's going to get better. Now, these things are things done to avoid surgery. So you don't have to have surgery. Plus, this patient's an elderly patient. He's going to be at high risk for the anesthesia. I use a combination of ultrasound and fluoroscopy. The benefits of ultrasound is that you can see the arteries, you can see the nerves, you can see all the surrounding tissue. Of course, fluoroscopy, you can see the bony structures, and that's usually mostly used for spinal interventions. So there you have it. My name is Dr. James Robles. I've got a lot of different tools. Basically, I take a holistic approach to treating patients. It's not just putting a steroid there and saying, here's your statin, here's your steroid. My approach is basically looking at their hormone levels, not the levels, but basically their state of quality of life and their function. Okay, I don't concentrate on levels. I concentrate on quality of life and function. The second thing, I look at their autonomic nervous system testing. And the autonomic nervous system testing, as before, looks into insulin resistance, the condition of their small arteries, the condition of middle-sized arteries, the condition of large arteries, and how the autonomic nervous system regulates the body in terms of how it's balancing inflammation versus anti-inflammation. And we have the other tools, IV therapies. Basically, once you come here and follow me, because we have the study right here. We have what's used, IV chelation therapy. So IV chelation therapy is basically toning to treat 51% of chance of reduced MRI. Now I want you to come here one more second here. I think this is gonna really astound you. And here we're going to go here. I didn't get this on before, but we're going to do it. Let's see here if we can do it. We're not going to put that there. And absolute risk reduction in primary prevention with statin. Okay. Let's see if we can find that. Oops. Okay, this is the big thing. Doctors give out statins like candy to women. Absolute risk reduction of a statin, 0.6%. Statins deplete coenzyme Q, vitamin K, omega-3s, selenium, zinc. They increase the risk of breast cancer. But your chance of getting any benefit of a statin is 0.6%. 0.6%. That means 167 patients will need to be treated with statin for 4.1 years to prevent death. I'm not making it up. That's why hormones are the way to go. Every man, every woman entering andropause and menopause should be on optimal bioidentical hormones. That's not happening. That's not happening because doctors are not educated, and that's preventive medicine. That's preventive medicine that keeps your loved ones, your grandfather, your grandmother, your elderly uncle that you love so much from having Alzheimer's, stroke, or heart attack. That's your decision. You've been informed. Now, what are you going to do? This is Dr. Robles signing off from Elite Medical Fitness. Thank you very much.